Welcome back into the Delta Dental Studios. It's 8:45. Emerson Phillips and Derek Cogswell. Glad you're with us this morning for Tee It Up Carolina. And right now we're going to get you fit for golf with Dr. David Scott from the Moore Orthopedic Clinic. You can call them at 227-8000 or visit them online at mooreclinic.com. Dr. Scott, how are you this morning?
I'm doing quite well. Thank you, sir.
We're glad to have you on the program. A lot of folks, Reed Morton's dealing with this ankle injury. Derek was telling me during the commercial break here that he's got something in his lower back that's bothering him, and he thinks it's from playing a lot of golf. He's been playing a good bit this summer, and he said it bothers him most when he's driving the golf ball. So I wanted to ask you, what are some of the most common golf-related injuries that you see, and what are some things that golfers who are listening to the program this morning can do to prevent them?
Well, the spine, just as you were saying there, the spine is probably the most common part of the body when it comes to golf. The spine is put under tremendous forces in the golf swing, especially with the drive. A lot of folks feel that kind of discomfort with the driver. That's the club they tend to swing the hardest with. And overall, I would say that the spine is typically the most at risk and the body part I see most in clinic.
Dr. Scott, we had you on last week. We talked about the importance of stretching, particularly for some of us, some of the folks here like myself who are a little bit longer in the tooth. It really pays to help limber your body up, to get the muscles warm and loose before you go out and even hit the first ball.
That's really true, especially when it comes to the back. If you're going to step out onto that first tee, it's really a good idea to get out there a little early before your round, warm up a little bit, try to break a little sweat. You don't want to go right out onto that first tee and start swinging out of your shoes. You want to break a little sweat. You want to stretch a little bit, and that's really the best way, at least on the golf course, from the moment you show up to the moment you tee off, the best way to protect against injury.
Dr. Scott, Derek Cogswell here. One of the questions that I've got for you, and I know Emerson touched on it a little bit, but basically what I experience when I'm out there golfing, especially with my drive, when I'm trying to really put both cheeks into it, it's that left hip area around my buttocks that almost seems to tense up, and then I get that pain shooting all the way down my left leg.
Right.
I've been to the doctor. They say it could be a pinched nerve. It's kind of undiagnosed at this moment. They're just working with it to try to see some different areas. To prevent injury, other than popping a couple ibuprofen prior to the round, what would you suggest?
Well, that's actually a pretty common sensation for folks that have back issues, and the back is a really complicated entity to deal with. Based on what you're saying, of course, these things are always difficult to diagnose over the phone, but there's two primary things in my experience that can kind of cause discomfort like that. One is a pinched nerve. A pinched nerve coming out of the back can certainly send some radiating discomfort down your leg. And there's another kind of more benign condition called sacroiliac joint dysfunction, where one of your hip bones develops an irritation where it rubs up against your spine bone, your sacrum.
Mm-hmm.
With those two bones attached, there's a joint called the sacroiliac joint.
Yes.
And typically pain in that area can cause a similar type of sensation in the leg. So, without seeing you, of course, it sounds like one of those two things may be the problem. But, in general, to kind of protect against those things and to do the most you can to kind of minimize your morbidity from dealing with those things, a good stretching program, a good core strengthening program. The more you develop the muscles in and around the spine, including the abdominal muscles and the muscles around your sides, the oblique muscles and transverse abdominis muscles, the more developed those muscles are and the more flexible that you can get that whole area, it takes a lot more of the forces off the spine and tends to prevent injury just in general.
Wonderful. Okay, thank you. I'll try that when I maybe hit the links maybe later today. Another question I have for you, as far as stretching goes, we all saw during the Open Championship Angel Jimenez's famous stretching routine.
Right.
I'm sure we want something a little more in depth than that. So what is I see a lot of guys taking a couple clubs and swinging them almost like the equivalent to a donut in baseball, adding weight. What, from the doctor's perspective, what would you recommend is a good stretching routine prior to teeing off?
Well, first of all, if you're going to embark on a stretching program, it's probably best to do it without an enormous cigar hanging out of your mouth. And then moving forward from there, I would say, those kinds of stretching programs can be tailored to the individual. I think the best thing to do is to go out with just, one, maybe two clubs, and just take some nice, easy swings, maybe 20, 30, 40 swings, just to kind of get those swing muscles loosened up. And then you probably want to do one or two things for your hip girdle muscles. That may be a kind of a forward flex position at the waist or kind of an extended position at the waist. The hamstring muscles and the latissimus muscles, the muscles that come down kind of from underneath your armpits and help you hold your arms down and kind of extend those arms up above your head, move side to side. These things are tough to describe. There's a lot of different resources online, and certainly in our clinic we have a lot of excellent physical therapists and athletic trainers that can help kind of tailor a good stretching and strengthening program to the individual.
We're talking with Dr. David Scott from the Moore Orthopedic Clinic, and we're going to open up the phones for you if you want to come on the show and ask Dr. Scott a question. We'd love to hear from you, 404-6100 or toll-free 866-667-1075. Dr. Scott, talk about the fitness movement in golf, and this is not certainly a brand new phenomenon, but 20 or more years ago, professional golfers in particular were not too concerned with fitness. And in the last, decade or more, we have seen players like Tiger Woods really move to the front as far as being exceptional athletes, guys who are very fit and very muscular. And we've seen Tiger really add on some bulk, some strength in the last 5 or 6 years of his career. And now we're seeing a lot of other professional golfers follow that lead.
That's right. Golf is a sport, and there's no two ways about that. And even though you're standing still and swinging a golf club, and you may not be running up and down a court or up and down a field, golf is a sport. And when it comes to injury prevention and when it comes to the development of power in the golf swing, conditioning is critical. I don't personally feel as though the conditioning part is as important for power development as it is for injury prevention. Now, there's no doubt that a good conditioning program can add yards to your drive and to your iron shots, and there is some power to be gained with a good conditioning program. There's no two ways about that. But when it comes to preventing injury, I think that's where the real payoff is for a conditioning program. So guys like Tiger who've come to the forefront and have really put fitness front and center for golfers, I think that they've kind of demonstrated that. Now, Tiger, unfortunately, is probably not the best person to use as an example at the moment because he's dealing with a lot of different injuries. But in general, a more fit golfer, especially with a good core strengthening program so that your balance is better, your spine is at less risk, it really can go a long ways towards preventing injury.
Now, Dr. Scott, obviously, probably some of the best things that people can do is actually come in to see you and, get a diagnosed, specialized plan. But one of the questions that, as we're talking comes to me is I know we hear so much about being flexible, not swinging out of your shoes, but just giving a nice pass at the ball and everything.
Right.
But you also hear a lot about core flexibility.
Right.
Do the two kind of lend hand in hand? Is one more important than the other?
Right. I think when we talk about core, flexibility is certainly a component of that, but really core is a matter of strengthening. When people talk about core, what they're referring to typically is the muscles in and around the abdomen, in and around the lower back. I like to think of core as inclusive of those things, certainly, but also, the muscles that stabilize the shoulder, the rotator cuff muscles, the muscles that stabilize the hips and the knees. When it comes to golf, I think core is a matter of getting you a good solid foundation, a good balanced golf swing. And the individual has to understand that they're going to have certain limitations as well. And when it comes to injury prevention, it's not simply a matter of developing a good level of fitness and core strength, but individuals need to understand that they should try to develop a swing that suits their body. I think a lot of injuries, at least in amateur golfers, come from trying to get into certain positions or swing in certain ways that they see on TV.
Emulate John Daly.
Exactly. And that may not be right for them. So when it comes to core, it's really a matter of building a good solid foundation to be stable in the golf swing, and then hopefully there's a good professional guiding the person and making them aware of the fact that they don't have to swing like John Daly. They don't have to swing like Tiger. They can have a shorter backswing. They can have a more compact follow-through. And those two things go hand in hand. Those two things are important in preventing injury.
Well, Dr. Scott, we appreciate your time and your expertise, and we look forward to having you on a new weekly segment here, Fit for Golf, with Dr. David Scott. We appreciate your time. Thank you, sir.
Absolutely. Enjoy it, fellas. See you next week.
All right. That's Dr. David Scott
Doctor.
from Moore Orthopedic. Right. You can check them out online at mooreclinic.com. You can also call their office at 227-8000. 227-8000, the Moore Orthopedic Clinic, 855.